Hey everyone, we're grateful for your support and hope our podcast has been helpful in both your personal and professional journey. One way to support our podcast is to sign up for continuing education courses. In fact, we have an upcoming continuing education live webinar on culturally informed clinical research taught by Dr. Monica Williams. And now, without further ado, let's dive into today's episode. We may see the external success of South Asian women in their careers, but for some, their contributions within their communities and families don't receive the same recognition. What is the disconnection that we and our clients are sensing? And how might we explore the contrasting role expectations placed on South Asian women across different aspects of their identity? With time, traditional paths may fade or form something new. So how can we best support the healing journey in a way that honors all experiences? Welcome to People of Color in Psychology, the show that explores mental health topics specific to culture, diversity, and communities of color. I am your host, Jack Sen. As part of our AAPI Heritage series, today we have Dr. Samina Ahmed Jauregui, a licensed psychologist who specializes in health psychology and is an expert of behavioral treatment on sleep disorders. Dr. Ahmed also has a specialty focus on culturally competent treatments for South Asian populations of Indian and Pakistani descent, where she incorporates the experiences of acculturation, bicultural identity, and intergenerational stress or trauma as part of a holistic treatment approach. As an Asian American Pakistani psychologist, Dr. Ahmed will be exploring with us how South Asian women may carry more burden than they might even be aware of. So when working with South Asian clients as therapists, there are vital considerations to help the healing process unfold. Dr. Ahmed, thank you so much for joining us today.
Thank you, Dr. San. I'm grateful to be here.
Well, tell me about your private practice work and about this message, how South Asian women may carry more burden they might even be aware of.
You know, this has been a very interesting process for me, and I feel like I might need to go back just a little bit to try to explain the story in its full context. And so one of the things I think worth noting is that my private practice developed out of the years in COVID, specifically with the initial lockdown. And the reason being because of the mental health crisis that also arose during that time frame, and the lack of accessibility to get into any therapist, much less specialty therapist from your background or specific ethnic group or racial group. And so when I kept hearing about the requests and the demands from colleagues, from physicians, from other providers saying, hey, do you know anyone? Do you know other Muslim providers? And at the time I was located in Ohio, so there was even less of a pool to pull from than it is here in Illinois or in the Chicagoland area where I am now. And so in Ohio, it almost felt like it was like a call to duty, or, I felt some responsibility that I'm here, I'm available, I have the bandwidth to do it, that perhaps I should try to put something together, something small, where I can be accessible to people of color who are looking for mental health resources during a dire time in need. And so I felt like it was important and necessary time, and nothing like the present, right, to start something and initiate that project. And so that's where my health practice or my psychology practice was born and created. When I first went about creating it, it wasn't specifically intended to just be for minority populations. But what's interesting is with my headshots and my name and, what's visibly available to the lay population, it's been funneled down to mostly people of color, to South Asian Americans, along with other ethnicities within the Indian subcontinent. And so on top of that, then you can branch out to other Muslim populations because of the headscarf and assumption that I am Muslim, which is correct. And so I've also had a lot of Muslim populations from North Africa and Middle Eastern regions reach out for services. What was interesting in the creation of all that and in going through all of that experience is that I don't really have a lot of Caucasian clients reaching out to me, despite my background in academic medicine, despite my specialty training in behavioral sleep medicine or my specialty training in health psychology services, right, which tends to be more sought after by Caucasian populations rather than the South Asian community. And so I thought that was an interesting experience because, every time you start to think like, okay, we're past that we're in a much better place now. People are more open-minded. Racism is a thing of the past, so to speak. It tends to rear its ugly head over and over again, right? In minimal ways or in microaggressions or daily interactions. And so I was surprised to see that that was the case this go around as well. So here I am, created my practice, opened myself up to whoever was needing the help and was willing to kind of accept the services and my experiences that I was offering. And so within that, I realized really quickly that these women were coming in with a consistent pattern, with a consistent complaint, with a consistent experience. And so the women that sought me out for services, first of all, tend to be more professional, young adulthood to middle adulthood, so 20 to 30s in their careers, establishing their families, just, building up their relationships, that sort of thing. And somehow they are finding that there's something missing, that there's something that's not there, that something feels unfulfilled or untreated, or it needs tendering, right? Something needs to be tendered to, and they're not quite sure what that is, other
Yeah,
than
so it's like something's missing. Yeah. And when they reached out to you, may I ask, most therapists, when they have their profile in Psychology Today or their intake process,
Mhm.
you mentioned there's certain themes. I want to think about more like a symptom, DSM, because that's what we're familiar with, which I
Yeah.
want to caution. Also, more of a holistic description, like, hey, something's missing, a different way to think about mental wellness as opposed to disordered thinking. When they were coming in, what were some of the issues that they were speaking to you about?
What's interesting too is that I made the mistake of being by the book, of using the DSM criteria, of promoting, specific criteria for depression and anxiety and health related concerns. Like if you pull up my Psychology Today profile, that's what it's targeting. It's targeting evidence-based practice. It's targeting all that psychological jargon that we're actually discouraged from promoting on these platforms. And yet that's exactly what I did. And I honestly, I don't even know if I even put one sentence. I believe my website might have like one or two sentences about multicultural care. I don't know that my Psychology Today profile does at all. And yet those are the people that sought me out anyways, simply based on, I think, who I am, right? Which I think is very important to learn from as a mistake on my part. And also acknowledging how desperate and how important this role really is, because even though I'm not providing them exactly what they think they need at the moment in writing, I'm enough for them to seek out. I'm enough for them to want to at least initiate a conversation to see if we can work together. And so it's during those initial consultation conversations over the phone that I offer, where I learn and I say, oh, yes, I do provide that. I am aware of that. I can help you with that. And then that's where I have my patients join me. And so, Jack, I believe you mentioned what are their concerns? And so a lot of it has been internal work that these women are after, in the sense that they accomplished family, religiosity, career, they're set in their paths, and yet they're thinking, okay, what now? What's wrong? What am I missing? And so a lot of them are coming to me, before getting married and suggesting, can I help? Can you help me work through some of my traumatic history so that I don't have to carry this into my new relationship? Or these are women that are getting ready to start families. And so they're suggesting, hey, can you help me work through some of my anxiety difficulties so I don't transfer that onto my children? It's very introspective, personal growth type of consultations where I've succeeded so much in the physical world, right? But psychologically, I feel like I'm more or less still that immigrant child within my household. And so how do I shed that skin and grow from it? And that's really where my conversations have been headed with a lot of the patients that I've been working with.
Yeah, so you're seeing how externally there's this validation, this tangible thing like, oh, career-wise, I've achieved this, family-wise, I've achieved this, but internally something feels off. It doesn't match up with my external world or experience.
Exactly. Like maybe I should be happier. Maybe I should feel more fulfilled, right? Like if we don't have that route and path perfectly laid out for us. And I think this is a very common experience for most professionals. It's like you go through undergrad, you go through grad school, you get your training in, and then you start your job. And now there's this existential crisis of what happens next, right?
Mhm.
There's no more laid out path for us to continue to follow.
Now, this is also an interesting take on this when we were talking about recording for this episode and the message of South Asian women carrying more burden than they might ever be aware of. And it's such an interesting way. It's like carrying a burden as opposed to something else. Like, hey, I am free from this burden. Like, well, what's the burden about?
I think a lot of the burden still has to do with traditional roles that women wear, that women carry, that women continue to carry now. And it's about navigating how to both honor your past, your traditions, your culture, your religiosity and spirituality, while also finding a self-identity and independence and being an independent person in this country, in this culture, in this world. And I think a lot of the burden is how to navigate that and where to find that balance and what gets more of our attention and when and in what context, right? Because I feel like that's an ever-changing balancing act that we have to continuously perform, but we may not always know when to transition, right? Or when to give more cadence to one thing versus the other, or if we even need to continue to do so. Or should we be happier living it in one dimension, sticking to one value, sticking to one identity for ourselves?
Yeah, as you're describing that, I can just visually think about all the pressures, like the
Yeah,
feeling, the role burden of I must fulfill this obligation based on certain society's expectations about
right.
my identity. And so, speaking of identity, we are, recording this for AAPI Heritage series. You also took a risk putting a professional headshot, just being you on your website. What was that like for you?
That's a great question because I thought about not putting up a picture. I did. I thought about not putting up a picture and allowing my experience to speak for itself. And then I thought about putting up a picture, but also a video where I would speak. And so they would hear my enunciation. They would hear that there is no accent, right? That there that there is no dialect from Pakistani culture, that I can communicate clearly and succinctly and understand what you're saying, which is often the bias that's placed on people of color, right? And I can't tell you how many times I've heard that in the past where, oh, you speak really well, or you enunciate really well, or I had a comment made where you would do well over the phone. Like I should be reduced to just customer service phone calls, right? When we call in to the larger corporations. And so, and it's interesting how they present this as a compliment, like I'm supposed to feel honored and so gracious that they're recognizing this for me. And yet what they're actually doing is microaggressing and letting me know that I am different and somehow still less than. And so I went through those challenges, and it's really frustrating and it's really exhausting. But like it's something so simple of not just what's my best picture, but should I put up a picture? What should it look like? Should it show my full hijab? Should I zoom into just my face so it's a little bit covered? So it looks like a neck scarf instead of a headscarf. Should I put the video up or not? Then at the end of the day, it's a matter of doing a value check for me. It's, what am I after here? What am I trying to accomplish? If I'm just trying to be available and accessible to those that are in need during this difficult time period, then I am who I am, and that's not going to change. Right. And so I need to just put my version of me on display, and either I'm a good fit or I'm not. But the ones that think that I'm a good fit and are able to work through their own biases and accept me for who I am are the ones that are going to reach out and want to get engaged in therapy with me. And those are the patients I want to be working with anyways.
Mm,
And so that was my decision factor of no video, only picture, full hijab, and then we'll see how it goes.
wow. It took a lot of courage because as you're mentioning that process, I also can't help and just observe some of the parallels of the women that you're supporting in their healing process. And you yourself having to bear the burden
Yeah.
of shielding and also addressing these microaggressions. your name, even questioning, spending all this time and energy, just, do I wear my hijab or not? When this is your identity and you have to question that,
Right.
that in itself is a burden. And I think one thing, when I have to say, finding South Asian therapists is very difficult. And then you break that down even further to look for Muslim South Asian therapists. And so sometimes, I'm on these professional listservs and they're looking for recommendations.
Mhm.
And sometimes, it's just hard to find folks. So I'm glad you are available. So
Thank you.
that being said, when there are therapists who do encounter and work with South Asian women, what are some vital considerations we need to pay attention as part of cultural competency, cultural humility to help the healing process unfold?
Thank you for asking that. Great question. And I feel like that's really what I want to kind of send home today and in this podcast. And I know we hear this all the time in multicultural training in that one class that we have to take in graduate school, being that try to approach the person where they are in their level of acculturation and their level of how much they've assimilated to majority culture versus their own minority identity, that sort of thing. And I honestly cannot stress that enough, because there is no one person that's exactly the same. And there's a lot of contextual factors that play into that. Listening to some of the other podcasts on your service, I heard about, multi-generational immigrants that have been here 7, 3, 4, 5 generations in. And I'm thinking, I'm the first generation, right? I'm a first generation immigrant. And what a different experience for a first generation immigrant who was born outside the country, moved here at an early age, and then had to navigate this essentially all on my own. Because even though my parents were here, they did not acculturate or take to this culture or feel the need to as much as their children did, right? And so my experience is much different than what my daughter's experience will be and what her children's experience will be. And yet some of the themes will continue generationally. And so I think that's worth looking into, that how long has it been since you've moved here and in what region? I've also noticed that people that settle in smaller areas of Ohio, in rural areas, right? Even Cincinnati or Dublin, Ohio, smaller areas with small Muslim populations or no Muslim populations have a completely different experience than me growing up in Chicago with a larger Muslim population and having an ethnic enclave of people that look like me, dress like me, and have the similar food options, right? Located in part of the city growing up. So I feel like where they settled, when they settled, what generation we're working with, their level of acculturation, because some want to embrace majority culture and completely shed their ethnicity, completely shed their minority status. And that's understandable. And I can meet them where they're at. And I think it's important to value that decision for them rather than making them feel ashamed of having to do so. I'm sure they get enough of that at home, which is probably a lot of what's feeding into their psychopathology now. Right? Versus those that strongly want to hold their identity, minority identity, and their race and their ethnicity. And so supporting them in that journey, supporting them in finding connections and support and getting connected with people who also value that in the same way is also just as important. And then there's the shifts, right? I feel like there's a common experience where throughout elementary, middle school, and high school, we want to do nothing but fit in. It's so important that we all fit in. Everyone needs to fit in. So we don't want to eat the food. We don't want to smell like it. We don't want to wear the clothes, right? We don't want to speak the language, and we don't want our parents speaking to us in that language when we're out in front of our friends and in public. And yet something happens in college, where you're introduced to more of people like you who've had similar experiences. For those that have the privilege to go to college, have that experience. And then you start to value your identity again. And then you start to accept who you are. And so then that brings you back to your roots. That brings you back to your food. That brings you back to your language and your dresses and that sort of thing. And then moving forward after college, there's a decision of, where do I fall on that scale of acculturation? How much do I want to continue to uphold? And so that's been a common theme that I've noticed. And so working with South Asian clients, I think it's important to just literally meet them where they are, also recognizing that this journey will shift and will continue to shift based on life experiences of marriage and geographical location, child, bearing children, and that sort of thing.
Hmm. Such an important point, and we hear many times, meet them where they're at. What region are you located? How does that inform your sense of ethnic identity? How that's even important as well. So, any other tips for therapists to consider?
And also keeping your own values in check. It's so easy for us to approach psychology, and this has been addressed many times too, in the sense that a lot of psychology was created for the Caucasian population, right? With male Caucasian population at that. And so it's not really adapted for females and people of color in particular. And so, and then it's also not very conducive to multi-generational family cultures versus emphasizing the independent person. And a lot of psychology is rooted on my own personal independence. If something is bringing you stress or trauma or difficulties, right? Set boundaries, cut them off, walk away, start over, protect your own mental health. And that's just not feasible for South Asian women in particular. It's just not feasible. And I don't know that it necessarily helps them feel any better, because those that are able to do it and find success in it may have some semblance of peace and quiet, but there's also a lot of guilt and shame. And I abandoned my duties. I abandoned my values. I abandoned my family. I abandoned someone, or, in some context. And so now you've just kind of changed the problem from I have no time for myself to be who I am and to pursue what I want to pursue, into now I feel guilt and shame in what I've left behind. And that's where I'm coming in from, where like you have to meet them where they are, because it's not the same for every person, but also being very mindful of what values you're enforcing on the other person. And so it's interesting because a lot of the consultation that I get from other professionals, from colleagues, is, I had this Muslim professional, very successful in her job, top of her class, management, CEO levels, etc., attending physicians, that sort of thing. And yet she still comes home to her mother-in-law dictating, what's for dinner for that night, or she doesn't know how to say no to her parents who are pushing marriage upon her, et cetera, et cetera. Or she's alone in raising her children, despite how much she's accomplished, even more accomplished and more successful than her male partner. There are still these more cultural expectations that they are navigating every single day. And I think the traditional response has been, well, why? Just change that, stop that. You don't have to listen to that, or find other ways, etc. Right? But I don't know that it necessarily cured or healed or helped them feel any better. I think those women likely continued therapy, but then left and then came to me and said they didn't have a great experience with someone outside of their race, someone outside of their ethnicity, that they didn't quite understand, that it felt like they were being judged. It felt like they were being forced into following a mind frame that they're not, that's not consistent to their own values or who they are. And so I think it's very, very important. It makes sense to us. It does. As professionals and having gone through psychological training, it makes sense to us why we want to protect the independent person and the individual, and foster that sense of self and self-identity. And I do think that's important. However, I think it has to be in the context of their values, of their greater values, of their family system. And so when I approach my work, if, say, for instance, it's a couple conflict or a relationship conflict, right, within a marriage, are you in a position of wanting to leave your husband? Is that what we're talking about? No, absolutely not. Okay, so now I need to work with you on finding you peace and happiness and joy within your marriage, knowing that this is not something that you're willing to do, right? And so by having those clear, focused, honest conversations with these women and knowing exactly what they're after beforehand, I think helps to guide the treatment process, because there is healing in that. And most importantly, it's visibility, right? And acknowledging them for where they are. And I feel like that in and of itself is, and someone saying that you're right to feel this way, knowing that they're not necessarily willing to change it, is really all they need to feel reassured that it's okay and it's going to be okay, and I can do this and I can uphold the
Different
titles.
values, the
Yeah,
different
and my
titles, the different
values,
roles.
all
Wow,
my
wow.
roles. Exactly.
Yeah, wow, okay. Well, Dr. Ahmed, thanks for sharing all this insight and experience, and just considerations if we do work with South Asian clients. So early on, you talked about some of the microaggressions faced. this is going to be a little bit more poignant. In your career as a woman of color, what were additional challenges you faced and overcame that you would be willing to share?
It's that's a difficult question because it's really hard to fully explain all of it. Sometimes it's just a nuance, it's a look, it's a rejection, right? But we can't necessarily pinpoint exactly what it is. However, I feel like all along the way, I've had to fight harder than my counterparts. I've had to be louder than my counterparts. I've had to work harder than my counterparts in trying to get to where I need to go. I, for some reason, seem to have a lot of conflict with other women, especially women, Caucasian women in particular. And so this is in the context of professors or guidance counselors and admissions counselors, where they seem to want to dictate what it is I need to be and who I need to be and how I need to perform and how I need to behave. I don't know where the subjective persona comes in of the South Asian woman, but it's translated into American culture as well. And so even though we ourselves are trying to fight against it, it's being upheld by the opposite culture, which I think is interesting, right? Like you want to blame us and fault us for oppressing the women in the culture, and yet you're also treating us in the same fashion. So I've had, unfortunately, throughout my training, I've had a lot of people tell me that I can't do it, that this isn't for me, that I won't be successful, or I'm not quite performing at the level that they expected of me, or I need to do more like legwork. I need to do a lot more extra work to try to prove my worth and value to then be able to succeed, to the extent that the master's program that I was in, I had to walk away from instead of transitioning into the doctoral program because of those very conflicts. And what's interesting is when I approached someone about it to discuss how I was being treated by these female professors, I was told that you can't fight every battle. This was the admissions counselor who was responsible for the cohort. And so I said, okay, and so you walk away, you go into another program, and I found another program that did value me and who I was. But then you also question, did I get in? Am I still not good enough? And am I only getting in because of my minority status, because I fit the diversity quota? Because then when you look around to the other cohort that you're joining with, you're 1 in 1, right? And so that doubt is always there. So not only am I experiencing doubt from others, that self-doubt becomes that much louder because of these experiences. Going in for my first job, salary negotiations, it's not enough to feel empowered to ask and to know to ask, to be well informed that you should ask for a higher salary than what's initially presented to you. It almost is insulting to them. Like, how dare you sit here when I'm offering you a job and ask for something more than what I'm already offering you? Like, you should be grateful that we're willing to take you on. Has been some of the experiences with salary negotiations or even transitioning and trying to move up in my career. And so a lot of those, experiences continue to shape you. And as much as you want to say that I'm better than that, and I've grown from that and it won't impact me, still carries with you. Right? It still makes you question your cover letter and your resume and which jobs you apply to and what risks you take in your career and how much you're willing to grow. And so those have been a lot of my challenges, in particular through graduate school and in my career, that shaped me. A lot of it being just focused on doubt. Like, what are you doing? Why are you here? Are you sure you belong here? And on top of that, there's the extra level of doubt that you get from your own culture, your own background. Like, what are you doing in psychology? What are you doing in mental health? Are you sure that's where you want to go? Are you sure that's what you're after? Maybe this isn't for you. Can you balance a career and be a mother? Can you balance a career and uphold your values of being a wife? Are you sure you're going to be able to do this? A lot of men don't want to marry doctors. You're getting it from both sides. And to kind of stick to your gumption of, no, I'm going to do this, takes that much more effort to complete anything, whether it's a master's or a doctoral level position, even going to college, or choosing not to go to college and building something and taking a risk on yourself and starting a business. There's doubt all around. And that's why I say for South Asian women in particular, there's a lot of burden that we're carrying that's not specific to just being a woman or just being a person of color, but rather the combination of the two.
Wow. Wow. It's amazing that you were willing to walk away from the master's program because some people would say, I'm just going to go ahead and suck it up and, you know, bear through it. And the arduous process of going to another program.
Yeah.
I mean, oh my goodness. I am glad you completed and got to where you are today doing amazing work.
Thank
So
you.
that being said, you've talked a little bit about how you would pursue treatment and some great recommendations and working with South Asian women in therapy. Can you walk us through your journey, particularly any memorable events and circumstances that influenced how you got into this work, knowing gone through so many challenges, yet you persisted?
That's a great question that you just asked. And what's interesting is I've been reflecting on this quite a bit myself, because unfortunately my father recently passed at the end of December. So I've had a lot of time to reflect on my relationship and my early childhood experiences with him and how I continue to carry his legacy today. For a lot of first generation immigrants, expectation is you cannot fail. We don't have that opportunity. We can't. Our parents worked too hard, sacrificed too much, moved across the world into a place where they can't speak the language, don't know the culture, and are trying to navigate their way through this with very limited resources. And for what? For us, right? For us to have better opportunities, a better lifestyle, to escape whatever war and conflict might be happening back in our home nation. And so I feel like there was this, at a very young age, you learn you can't fail. Failure is not an option. And it's because you want to value your parents. You want to uphold their sacrifices. You want to make it worth it for them because they sacrificed a lot. And I can only imagine being in their shoes and seeing it from my eyes. It was jarring enough, much less what they had to experience. And so both my mom and dad from Pakistan had master's degrees and they were in a professional role. When they migrated to the US, which a common experience was they had to work beneath their education level, right? And so my dad was a taxi driver in Chicago, and my mom worked in early childhood education, so daycares, and then a substitute teacher. And so watching them, but then knowing that they have this background, this education, and how intelligent and smart and resourceful they really are is frustrating, right? And this is a little bit of pop culture, but there's a meme that was recently going around with Sofia Vergara from Modern Family, and how she said, do you even know how smart I am in my own language? Do you know how hard it is for me to take in everything you're saying to me, interpret it into Spanish, and then back into English and say it out loud? Like, you can hear the frustration in her voice. So I thought she delivered that perfectly. And I really resonated with that because I feel like that was a very common experience from my parents. Like, they are very intelligent and resourceful and they know what's going on. And yet they're talked down to and belittled and mistreated, especially in the early 90s when we first migrated here. And to witness that, to be the witness of it, right? They're not speaking to me, they're speaking to my parents in that tone. And I know what that tone is that they're using. They're talking down to my parents. And I at the time, I thought my parents didn't quite catch the tone or didn't quite catch the connotation with which they're speaking. And yet you come to learn that they knew it all along, but they didn't have an option. It had to be yes, sir, yes, ma'am. And I think a lot of those early experiences shaped who I was and what I was going to do in life. And then what I value most is my father being one of those fathers that really valued female education, really valued women in education and wanted us to proceed. There was no expectation of you're not the firstborn son and you're not performing, I'm the second eldest. I have an older sister and two younger sisters. So there's 4 girls and then the youngest is a boy. And he raised us like he would raise a son. And the expectations for us were the same as he would have for an elder son or the eldest son. And there was no difference between what a son can do and what a daughter can do. And I look sitting here now, I reflect on that a lot and how much I valued it and really appreciate him for doing that for us. I remember a psychologist got into his taxi cab one day and he told her that I'm going into psychology. I'm trying to get into a graduate program. So he called me on his cell phone and gave her the phone and had her speak to me in that moment. I wasn't quite sure what the dialogue was supposed to be, but just that he was proud of the idea, proud that it was happening, and really encouraged me to pursue what I needed to do. And he said, I just want you to be successful. And I'm sorry I can't help you along the way, because his expectations for us were clear. but he didn't know how to navigate student loans, college admissions, graduate school, and what that looked like. So a lot of that fell on us to try to figure out along the way as we worked our way through it. So there was a lot of mistakes that were made, a lot of roadblocks that were faced, and yet I kept going. I kept going because there was no other option. So I feel like that's been my journey, knowing that we came into a brand new world. I saw my parents mistreated. I saw them working beneath their education level. I saw them constantly disrespected. And so you want to do better and you want to appreciate those sacrifices that they did make for you to have a better life. And so I made sure that I had a better life and was able to bring them up with me. And so I know that he was happy with our success, regardless of it not being, medicine as is commonly enforced upon us. And not just being out of fear, right? Like you want to make sure you have a job where you're respected. So you have the title, you have the respect. And that's what he wanted for us. He didn't want the mistreatment. He didn't want us to experience what he had to.
Looks like part of your journey in many ways was unknown, yet it was supported. And you mentioned there was no option to fail. You did it in a way that in many ways honored your father and your family and yourself
And my people.
and your people. Yeah. Yeah. Well, Dr. Ahmed, any final thoughts and how can we support you?
I love what's happening now. I love how many more Muslims are being vocal and seeking out mental health services. I didn't expect that to be the case even today. So I love that we are more open to the idea of mental health services. I love that more people are getting into the profession and more people are willing to meet with a therapist to discuss these issues. I love that women are seeking an introspective lens on themselves and wanting to do better for themselves. And I want to support that fully. But at the same time, I understand that I'm one of one, right? And there's only so many other South Asian providers who can take on other South Asian clients. And so I want to encourage my colleagues to not be afraid or shy away from other South Asian patients or feel the need to put them in touch with another South Asian provider, but rather seek out consultation and meet with a provider so then you can continue to meet the needs of this population in a meaningful way that's valuable to them and their experiences while keeping our own biases and our own expectations in check. So there is a shortage. I wish there was enough of us to go around for everyone to refer out. However, if there isn't, I don't want people to feel too apprehensive about wanting to get into treatment with a South Asian person of color or a Muslim person, or a Muslim patient per se. And I'm excited for where the future lies. And I think our Arab Muslim counterparts are really setting the way in terms of what they're establishing and building and growing. And they've been here a few generations more than the South Asians have. And so I love to see it. And they're way more open to treatment and psychological services. The South Asian community is just getting there. But I think with access to care, more accessibility, more visibility, and normalizing this. And so having platforms like your own is very crucial and very important. And so there's still a lot more work to be done. But I appreciate all the effort that is already being made and everything that's already changing in the context of psychological care for minority populations.
All right, Dr. Ahmed, thank you so much. Is there anything we can do to support you?
I am here. I am available. I am accessible. I do individual therapy. My website is posted along with consultation work. Like I said, there's not enough of us out there. It hurts me to have South Asians kind of stuck in the loop and not be able to get connected with someone. And so please seek out consultation services. There were some great resources through your podcast, along with can be found through Muslim organizations or South Asian organizations. And so I strongly encourage everyone to get involved, to seek out these resources, to learn and not be apprehensive about getting into treatment with South Asians. And so I am here. I can help and support you in any way within my means.
All right, Dr. Ahmed, thank you so much for your time today.
Absolutely. Thank you again for this opportunity.
A huge thank you to our listeners. If you enjoyed this episode, please share and subscribe to People of Color in Psychology. You can also support us by registering for continuing education courses or making a one-time donation on the Multicultural Counseling Institute's website. Your feedback is important to us. So feel free to send an email, a message on LinkedIn, or leave a voice message on our website. Until next time, this is your host, Jack Sun.